but knowing your breast cancer risk and potentially getting supplemental imaging is important.
And how does one know their breast cancer risk?
Yeah, there's a couple of different ways. So the first, we always start with, people always think, oh, I don't have a family history of breast cancer, thus I'm not
Mm-hmm.
at risk. And so we want to debunk that. Some people do have family history, many don't. There are a number of calculators available. The most common one used today is the Tyrer-Cuzick, which is a publicly available model, and we can share the link for you
Great.
to share with your listeners. And you can do it on your own. You can do it with a healthcare professional, but it does ask about family history. It asks about breast density. And you don't know your breast density unless you've had a mammogram. So people say, oh, I feel my breasts are dense. No, only can tell on a mammogram. It asks about menstrual history, reproductive history, all these things. And it's not perfect. It misses a lot of people. But if you are high risk, meaning you have a 20% lifetime risk or higher of being diagnosed with breast cancer by this or other calculators, you are considered to be at high risk. And for that, we then think about, do you need additional imaging to your mammogram, like an ultrasound or an MRI? Even if you're not high risk, but you have dense breasts, if you have dense breasts, that is a breast cancer risk factor. And it can also make it harder to see things on a mammogram. So for then, we might think about, again, should you get an ultrasound or an MRI? There are no definitive guidelines around imaging for dense breasts at this point. So it should be an individual discussion with your doctor. But what I see very often is people get a mammogram and the mammogram is negative and they're like, cool, done. And they move on. And in that mammogram, it also says that they have dense breasts, but no one told them that. And it's buried in a line, somewhere at the top of the report. So I really urge people to know, do you have dense breasts? Have you had a specific conversation with your doctor about that? And ask the question, I have dense breasts. Should I get supplemental imaging? So don't assume just because everyone's like, you're good, that everyone's looked at all those things.